Hello. Thank you all for coming. It's brisk, but it's a beautiful day, and I'm sure it will get warmer as the time goes on because the sun always does that during coffee hour at this hour. For those of you who don't know me, my name is Sue Asselin. I'm the parish nurse here at First Congregational Church. And this morning, it's my pleasure to welcome Dr. Stephanie Paulmeno, a neighbor, friend, colleague, so much more. I met Stephanie more than 25 years ago at a meeting in the town called the Senior Health Providers. That is a group of professionals with the purpose of improving the lives of the senior citizens in Connecticut. Stephanie is an inspiration, and I've seen her tirelessly serve on many boards and committees, all aimed at the betterment of the health and welfare of others. She has a doctorate in nursing and is board certified in public health. She has a master's degree in gerontology. She's a COVID contact tracer and vaccinator, a member of the Greenwich Medical Reserve Corps, and the president of the Connecticut Nurses Association. I could go on with Stephanie's accomplishments and active roles, but that would take too long. So she joins us today in her current role for the Town of Greenwich Health Department as a public health promotion specialist. Welcome, Stephanie.
Thank you so much, Sue. Yeah, it's hard to imagine how long and how far back Sue and I go. And we've walked some interesting paths along the way. By way of a little history, one might wonder why I'm standing up here talking about COVID the way I am, but I'm the person who developed all of the pandemic plans for the town of Greenwich during the avian flu era. The SARS plan, the mass immunization plan, the nursing home pandemic plan, and all the bioterrorism plans for the town of Greenwich. Thank you. That was when I worked for the town as the director of community health planning. And I was there for about a decade, and then I retired and started my own company, Global Health Systems Consultants, which I've been running since 2009. But when COVID struck, being a nurse and having the background I have, I put all my business aside and devoted everything I was doing to COVID. So I ran, I think it was 50 or 55 weekly sessions for seniors on telephone sessions on COVID. So we covered every conceivable aspect. And we did it by telephone because a lot of seniors didn't have access to computers or weren't computer savvy. And even though I got my doctorate, I'm not terribly computer savvy, so that worked just great for me. Okay, the situation we have today is really a profound one. It's the worst pandemic we've had in our history, but it's not our first pandemic, and it's not going to be our last pandemic. And we're learning as we go. Even what we know about COVID-19 today is different than what we knew about COVID-19 a year and a half ago. What we do know, I see you've got the sun in your eyes. Did you want to change seats? Okay. Okay. When COVID first emerged, it really kind of took us by storm because we were not prepared for the veracity of that particular virus, for how quickly it was going to spread. And we should have been aware, but we don't appear to have been. Fully aware of the fact that viruses change. It's the nature of viruses. Every virus changes. It's why our flu shots every year are different. Viruses have what they call shifts and drifts. They make small changes, and then periodically they can make very major changes that can, in essence, turn the virus into a totally different disease. And we've been very on the alert and working and worrying and waiting and hoping that doesn't happen with COVID. Delta virus was a big change for us, but it was still a drift and not a shift. Okay. We have other viruses or shifts, mutations coming up down the pike, so we can't drop our guard. Okay. But all in all, I really wanted to say the state of Connecticut and Greenwich is doing very well. We've come through some very difficult battles. It's been a long, hard, arduous course for us. We have been in the top 5 states in the country consistently for getting our people vaccinated. But even with that, we still have only here in Connecticut, only 69.13% of our people vaccinated. And that jumped up when we were able to get 12-year-olds and higher vaccinated. So we're still working to get that there. That's pretty much the only way we're going to get full protection. There used to be a figure of 70%. If we could get 70% of our people vaccinated, we'd reach herd immunity. But the more contagious the virus is, the higher the number we need to have vaccinated in order to protect ourselves. Now, we do have people coming down with the virus, and they develop a certain type of protection, but it's not as robust a protection as you would get with a vaccine. So we are encouraging, the health departments, the state, local, CDC, are encouraging people, even if they've gotten the disease, to get the vaccine. And it's sad, but pretty much everybody in the hospital, in the ICU and dying, are unvaccinated people. And as a contact tracer, I can't tell you the hours or the nights I've lost sleep over the people I'm working with. Now, as a contact tracer, we're working with people in the community. So we're not dealing with the people in the intensive care unit or even in the hospital. At my age, I'm going to be 74. I could not go into a hospital and work in that kind of a setting because the risk was too high. But I could work with my Medical Reserve Corps, I could work as a contact tracer, I could work as a vaccinator, and that's how I was helping during the issue. Some of the other things that I was involved in, I actually have just finished my term of office as the president of the Connecticut Nursing Association. It ends tomorrow. With an award ceremony, and I've been surprised because they're giving me the Lifetime Achievement Award, which I had no idea about. So I'm humbly honored for that. But it's been a long road. I've expired all the terms of office I can do with the health department. So all I can do now is be on the board as a volunteer. I can't hold any official office. Okay. But it's been a journey, and I know Sue is a nurse because we've worked so long. I don't know if we have any other nurses here, but I was so touched by the Reverend's sermon because it touched me on so many personal levels. I think pretty much every religion holds the human body as a temple to the Lord. And for many years I served on the the Connecticut Commission on Health Equity, and I chaired the outreach committee, and I worked to try and get all sorts of religions to celebrate one particular day of health equity, and I always kind of started with that. I looked up every religion I could think of, and pretty much that was a theme throughout all of them, that the temple is our body. So we certainly want to focus on that here. But going back to the topic for today, we are in great shape, as I said, right now. We're doing exceedingly well. We've gone from being a red state, to a red town and a red state, to being an orange town and an orange state, to now being yellow. There's only one level left for us to go, and that's gray. And if you picked up the handout that has the little color chart on it, a red zone means that you have 15 people or more over a 2-week average per 100,000 people. And if you're in the red zone, you're in a state of high community transmission. We were there about a month ago. Then we dropped to the orange zone, which was 10 to 14 people. And that's substantial community transmission. Still not good. Not good, but okay. Now we're yellow. That means we're having between 5 and 9 people per 100,000 people. And that's pretty good. And when we get to below 5, we'll be in the best zone we can be. Now, we don't have 100,000 people in Greenwich. We're 36,000 whatever. But public health uses that 100,000 figure to kind of level out between large cities and small towns. So they use that in that kind of a category. But we have to be careful because we're a very small state. We travel all over the state. We're a border state where it's very easy for us to go into any one of our bordering states. And all of Connecticut is not doing as well as Greenwich is doing. If I put a lot of resources in the back, and if you look at the Worldometer or any of the ones that gives you this color coding of how the state of Connecticut looks, you'll see that north, south, east. The eastern portion of Connecticut is very red. We have pockets of red zones in different locations. So if we travel to a place where the community spread level is very high, we may bring it back with us and not even know we've become infected. And that can be the case even if we're vaccinated. That the vaccine does not protect you necessarily against becoming infected. It protects you against becoming very ill, against being in the hospital, against being in the ICU, and against ending up in the morgue. So that's what the vaccine does for us, and it's virtually 100% effective in doing that. As I said, virtually every person, it's 99 point something percent of the people in the hospitals, ICU, and dying are unvaccinated people. But we're a country with choice. What I try to do in my public health approach is not blame people, tell people what to do, but suggest to people that these are the facts. These are the people who are at high risk. A lot of parents are concerned about getting their children vaccinated. So I'm not going to say, you have to get your children vaccinated. I'm going to say, if you're Black, if you're Hispanic, if your child is obese, if your child has any one of the multitude of rare diseases, if your child has diabetes, asthma, numerous conditions, which I list in the paper that you have here, then your child is at high risk. And you have to make your decision based on that risk. And that's not only for children, that's for all of us. We've seen, I think, health equity or health inequity has been highlighted so clearly during the pandemic because we've seen that it is not affecting all of us equally. And again, it's our people of color, our Hispanic people, our people who are in lower socioeconomic groups. It's even people who are non-English speaking because access to care is not necessarily the same. The understanding of the information is not necessarily the same. So we work to try and help people look at their own risk, make their best judgment for themselves and for their family members. Now, do I think everybody should be vaccinated? 100% I do. I could not go in any other direction. I certainly supported and actually led the movement in my state for all healthcare workers to be mandated to be vaccinated, because I feel that nobody working with vulnerable patients, and if we're a nurse, we're working with vulnerable people, none of us should be a vector of disease to the people we're caring for. That was my opinion. Our nursing board met for over an hour and we looked at every angle of this, and not everybody was of the same mind originally, but we ended up being unanimous in joining with the American Medical Association, 70 some odd other organizations, the hospital associations, the American Nursing Association, in calling for mandatory vaccinations for healthcare workers. So it was not necessarily a popular decision all around the board, and I'm sure we will lose nurses for it, but I'd rather lose nurses to another field of practice than patients getting infected because a nurse carried it. And what makes it so difficult, and you probably know this already, is that we can have COVID and not even know we have it. You don't necessarily have to have a single symptom. We frequently see people checking your temperature. Loads of people with COVID have no temperature at all. Here in our country, we have erred egregiously, I fear, on the side of not getting people tested. We were only testing, and we're still pretty much only testing people who had symptoms. Well, that left a whole bunch of people out who didn't have symptoms, and those are the ones we actually needed to reach so that we could isolate them, protect others from them, and try to stop the spread of disease. So it's been moving along slowly in that regard, but we are moving along. Going back to how we are here in Connecticut, we still have 40 red zones and 40 orange zones in the towns of Connecticut. So that's a lot of places where we have high community transmission and substantial community transmission. So if you're traveling to places, I would urge people, wear your masks. If you're in indoor settings, if you're in close contact with somebody, don't take a chance, because you have no way of knowing whether the person you're sitting with has COVID or not. And that goes for children. For a long time, people thought children were not transmitters of COVID. They carry as high a viral load in their throat as any adult. They transmit it just as easily. We've been having increasing numbers of children becoming infected. And I was writing an article that I was hoping to get done before I came here so I could give it to you, but I was 2 paragraphs shy when my time ran out. So as of 10 days ago, over 6 million children in the United States were COVID positive. 6 million children. More than 148,000 of those cases, were added in just the past week. Now this is in the country, not here. And more than 750,000 children had joined that group just in the last 4 weeks. So for some reason, we've had a big increase in the number of children with COVID. And that's alarming to me because a lot of these children are now eligible for vaccination. But we have different areas of the country where vaccination is more popular and areas where it's less popular. But again, I point out here, or I want to point out here, that the American Academy of Pediatrics has really studied this issue and looked at that, and they're strongly advising that children get vaccinated. Another group of people who are being strongly urged to get vaccinated are pregnant women. The CDC, about a month or so ago, made just the fact of being pregnant a high-risk group. And pregnancy is a burden on the body. There's no doubt about it. So you're strained a little further. But there is absolutely no reason for a mother who's pregnant to not get vaccinated. When I talk about the myths, a lot of people have been worried that the DNA, the RNA vaccines, the messenger RNA vaccines would affect your DNA, that they go into the nucleus of your cell, that they could affect your genetics. None of that is true. It's completely misinformation. The mRNA vaccines, which are Moderna and Pfizer, never enter the nucleus of the cell. I kind of like to describe them like they send a messenger in like a, what do they call that? One of those copiers, like like taking a copy of a piece of the spike, not even the whole spike. And it tricks the body into thinking you have COVID, and you develop this robust response to having what they think is COVID, and then your body destroys that piece of the messenger RNA, so there's absolutely nothing left in your body except what your own body created as a response to the vaccine, to the pandemic. So you get a nice, very strong antibody response. The other vaccine, the Pfizer vaccine, is your traditional vaccine. It's what's called, I'm sorry? The J&J, thank you. Yeah, thank you. Yeah, the J&J is what's called a viral vector vaccine, and that uses a weakened form of another virus, like the common cold, or in the case of AstraZeneca, they use a chimpanzee vaccine, which again goes in and your body creates this very robust response to being attacked by the virus, and you develop a strong antibody response. You could not go wrong with whatever vaccine a person decided to take. They were all safe, they were all effective. The numbers of reactions that people had, and you've probably heard about the cardiac inflammation and the women who developed blood clots. Well, those were true, and those numbers were a little higher than usual, so there probably was a correlation to that. But when you look at the millions of people who took those vaccines, it was a minute percentage of people. And my answer to that, being a healthcare provider, is if you know that women of childbearing age could potentially get this risk, then don't give them that vaccine. Give them one of the other. If you know that the inflammation of the heart is something, don't give that vaccine to young boys in that age group. Go with something else, because the benefits of the vaccine so far outweigh any potential repercussion. Bear with me while I turn a flipped page. Also in the handout that I gave you, if you turn to the second page, I had the figures for where we stood as of 10:15 last night in terms of our numbers. And I don't need to read them to you. You can see them there. But again, Connecticut and Greenwich are doing great. So I had a number of questions that were submitted to me in advance that I thought I'd cover here. And then I put in a whole bunch of other potential topics if there was time, and if anybody had anything. And if there's any particular question that somebody has, please throw it out and I'd be happy to answer it. And if I don't have the answer, I'll find it and get it to Sue so she can get it to you. So one of the questions was, do I have to quarantine if someone I live with tests positive for COVID? And I went back and checked the CDC guidance as of 10 o'clock last night, so everything I'm telling you now is exactly what the CDC has on its website as of right now. And that's important because the information changes. A lot of people, one of the critiques has been that people don't know what they're talking about because what we said yesterday is different today. Well, that's true. Not that we don't know what we're talking about, but that things have changed because we're learning more and more about the virus and the conditions and the situation changes. So the CDC guidance to that question as of 10/4/21, that was the date of the document that was there, is that you must quarantine throughout the isolation period of the person in your household. Now, as a contact tracer, I often start with one person in a household. And in the last couple of months, it sweeps through the entire family, even when they're isolating in their rooms. It's hard because as a public health nurse, normally you would go into the home and make sure they're doing everything right. We can't do that as contact tracers. But it's going through the entire family. It's going through the extended families. It's going through friends. It's going through schools. It's going through preschools, such as you have here, and it's going through after-school programs. So the guidance there is that you continue to quarantine for 14 days after your last exposure to the last person in the household becomes clears. And when you count your days, you take the day that you were exposed as day one, and then you count out. Now, as contact tracers, we had been being told, monitor people for 10 days out. That you count day one, you count out 10 days, and if at the end of 10 days they have no temperature, their symptoms are greatly reduced, but they don't have to be gone, and they're not taking any medication for a potential fever-reducing medication, then they can come off quarantine and isolation. The CDC guidance on the site yesterday said 14 days. Okay, so the next question, any questions about that? Okay, so the next question was, if I'm fully vaccinated, do I still have to quarantine if I'm exposed to a person with COVID? And again, as of 10/15/21, 10 o'clock last night, okay, the CDC guidance said, if you're fully vaccinated and you come in close contact with a COVID-positive person, you should get yourself tested within 5 to 7 days of your exposure. So why 5 to 7 days? A lot of people run in and get tested too soon, and their body hasn't had a chance to develop the condition, and they test negative, when in fact, if they waited a few days, they would test positive. So you also, even if you're vaccinated, fully vaccinated, you should monitor your symptoms for 14 days because that's the time period that you could potentially emerge. You should be wearing a properly applied mask if you're in public indoor settings for 14 days or until you receive a negative test. If you're fully vaccinated and you get a negative test, you're free and clear. If your test comes back positive, then you have to go into isolation. And that's probably a good point to say. A person who has COVID goes into isolation. A person who's been exposed goes into quarantine. So it's basically the same process, but it's just different terminology. So also, if you are exposed to somebody and you live in a home or a setting where you have other people who are immunocompromised, then you're advised to wear a mask even at home for those 14 days or until you get a negative test back. Now, I mentioned close contact, and that bears mentioning because what is close contact? Your thought of it may be very different from my thought. The CDC guidance on close contact is that you're within 6 feet of a person masked or unmasked, it used to be masked or unmasked, for 15 minutes, or any combinations of people for a total of 15 minutes over a 24-hour period. That's a change from what it was at the beginning. It used to be 6 feet, an unmasked person, and a single person. Now they're saying you might go around your day and not even know you've crossed paths with 10 other people who have COVID that you and they don't even know about, and that would be a high-risk exposure for you. So again, we're missing a lot of people on COVID, on finding people with COVID. So if you're fully vaccinated and you have no symptoms and you follow all the testing and masking conditions, you no longer need to quarantine or be restricted from work. So that was a more recent change. Okay. And I mentioned what the close contact is. Okay. So the next question that came to me was, do I have to quarantine if someone I spend time with notified me that they tested positive? And for how long? Yes, you have to go into quarantine upon being notified because you're not the person with the disease, you're not going into isolation, you're quarantining and getting tested within 3 to 5 days after your contact and monitoring yourself for 14 days. If you're fully vaccinated, the CDC again says you do not need to quarantine unless you develop symptoms or if your test comes back positive. Then we have the very current issue, question about what's the difference between a booster and a third dose. And it's confusing because it's not actually dissimilar. It's more a terminology change. The boosters right now are only Pfizer. Moderna has been approved by the FDA, but it hasn't gotten the CDC approval or the guidance to go down for that. So right now it's Pfizer. So the booster for Pfizer is approved for people who are over 65, as well as for people who are between the ages of 50 and 64, who have underlying health conditions, people who are high risk. Okay. If you live in a long-term care facility and you're 18 or older, you're eligible for a booster because you're exposed to people who are at high risk. And again, we don't know who has COVID. You'd have no way of knowing if someone has no symptoms, and that's a lot of people. Okay. People who are 18 to 49 with underlying medical conditions that put them at risk for COVID are eligible for a booster. Employees working in high-risk fields are eligible for a booster, and that would include healthcare workers, first responders, people working in schools, people who are working in the food and agricultural and manufacturing industries because they're often standing side by side with people. People working in correction facilities. You may have heard that Rikers Island has had yet another death of a prisoner from COVID. And the conditions in the prison systems are horrific. I'm talking about lack of access to care and social justice issues. The prisons are a hotbed of problems. Okay. Postal workers are considered high-risk people in public transport, and of course those people who are working in our food and grocery establishments. So all of those people are eligible to get the Pfizer booster as of right now. And they'll be the same people, in all likelihood, who are going to be eligible. Thank you. I don't have enough hands, Sue. Okay. They're going to be, in all likelihood, the same people who are going to be eligible for the booster when Moderna and Johnson & Johnson get approved. Okay. The third dose vaccines, it's really referring to an extra vaccine that they're going to allow to be given to people who are immunocompromised and who need a little extra help to boost their immune system. So Moderna, I understand, is going to be a half dose. The Pfizer vaccine went with the full dose. I don't know what the situation will be with the Johnson & Johnson, but that's where it is right now after the FDA approval. The CDC can change that, so we don't know. Okay. Then there was a question, where can I go to find a Johnson & Johnson vaccine? And why are they harder to find? I don't actually know why they're harder to find, but I provided here 3 different sources on the paper for you, links, where you can go into the link and identify a location to get a vaccine of your choosing. You can go to www.vaccines.gov. You can text your zip code to a particular number, 438829, or you can call a 1-800 number to identify locations near you that are giving the vaccine that you want. Or you can go to the Greenwich Department of Health website, and I put a link there. You can just Google greenwichct.org and go to Health Department and get that. And you can access the state of Connecticut's COVID portal to find testing sites, and that's www.portalct.gov. And again, there's a whole bunch of resources in the back. So a question was, do I expect people vaccinated with Moderna and J&J will soon be advised to get boosters? Absolutely. They're definitely being advised to get boosters, and that's in process right now. But we're still worried about getting unvaccinated people vaccinated, so that's a high priority. And of course, there's an ethical issue there too, because here we are in our country focusing on getting third vaccines when so much of the world has not gotten vaccinated at all. So I know that we are working on getting vaccines out to other people, but it is an ethical issue, and it does concern me, because we have countries where it's almost like single-digit percentages of the population are vaccinated, and this is a pandemic, and by its nature, a pandemic is worldwide. We cannot solve a pandemic in this country. It has to be a global perspective. Okay. So the next question focused on contact tracing. What is it? What did we do? How do we get the patients? When somebody tests positive for COVID-19, their test result is sent to their state health department. So here in Connecticut, it's the Connecticut Department of Health. That department sends the result and the paperwork down to the local Department of Health. So here in Greenwich, we're getting all the cases who are Greenwich people. But we're not the only people getting those cases. The hospital monitors some people on their own. Certain schools and colleges monitor the people in their organizations. Some of the preschools and whatnot. The Board of Education has monitoring there. And you should be aware that the Board of Education's standards are different than the health departments and the state health departments and the CDCs. They've taken a more stringent view. And we tell people, if they're in the school system, go with what the school says. They have an awesome responsibility to protect children, virtually all under 12, not virtually, all 100% under 12 who are vulnerable because they're unvaccinated. Okay, so basically contact tracing is investigation. When we get the case, we call the person. If we're lucky enough to have them pick up the phone, and we do have a certain number of people who don't, and I myself, if I don't recognize a number, I often won't pick up the phone. So that's part of the issue. But what I do is I reach out by phone. I reach out with a handwritten note that I put in a packet of information that I send to everyone from the health department. And I also text people, so I try by all routes. And I try throughout the full duration of it to try and reach people. And the information packet, if we never do reach them, doesn't give us any information, but it provides them with a lot of information. So it's a public health technique that's been in use for many, many decades. And what we aim to do is to find the people who have been infected, find out who they've been with, find out who they may have caught it from, reach out to all the places where they have been. So we ask them, have you been out of the state or out of the country in the 2 weeks before you became ill? Have you been to any restaurants? Have you been to any health clubs or nail salons or beauty parlors? Have you been to social engagements? A lot of the events that we've had, big clusters, have been weddings and funerals. Lots of people getting together. And it's been tough. I mean, those are not events that you want to miss. But if you're not vaccinated and you're mingling in there, or even if you are vaccinated, we have a lot of breakthrough cases now. People who are fully vaccinated but who are getting mild cases anyway. And again, remember, they can spread the disease too. So we're reaching out. It takes hours to do the contact tracing. When we were in a much heavier state, like right now, I think I only have maybe 10, 15 people that I'm monitoring, and multiples are in one family. So when we were in the heavy phase, I would be going like from 8 o'clock in the morning till close to midnight. But after 9 o'clock, I'm not going to be calling somebody, so I'd start texting and going through like that. But We want to find out not only if they know where they got the disease, if they can tell us where they've been, do they work, are they a healthcare worker? Many people don't want to share the location where they work. So I also ask, have you notified the places where you've been? Have you notified the places where you work that you tested positive? And it's important. We would never call a place and tell who the person is. We would call and say, I want you to be aware that somebody who was positive was in your location on such and such a date, or is a student in your school, or was in your gym. And if you know who the other people were, notify them to get tested. And really, they should be in isolation, quarantine, until they know whether they're positive or not. Okay, so that's pretty much what we do, and then we keep monitoring them throughout the full duration of that period. And I have lost sleep on so many cases. I had one man who had 104 temperature for days. Now, this is a person being treated at home. One of the concerns that I've had is that we keep hearing that our hospitalization numbers are going down. They are. But the very, very sick people are in the community. So I would ask, why are our deaths going up, but the hospitalization numbers are going home? And nobody's been able to give me an answer to that yet. But my own feeling is that we have more and more very sick people in the community. So with this fellow with the 104 temperature, I sent him to one of our local hospitals 3 times, and they kept sending him back home. And I called at one point and spoke to the hospital advocate, and I said that this man is deathly ill. I would worry he wouldn't be there in the morning. I'd call multiple times a day. Thank goodness his wife was a physician from another country who couldn't practice here, but I knew she was monitoring him. I had another man just last week who was running very high temperatures. His wife and he are both high-risk people. She's in her 2nd term of a high-risk pregnancy. He has Crohn's disease, an autoimmune disease, and is on all kinds of autoimmune medications. He kept testing negative, and yet he so clearly seemed to have COVID. So I said to them, you go talk to your doctor. And it turned out he didn't have a doctor here. His doctor was in New York and couldn't order here. So he ended up going to the emergency room. I said, you need to let people know that you're on these immunosuppressant medications, that you have an autoimmune disease. So we advocate for them. He ended up being prescribed the monoclonal antibody treatment, which is what I wanted him to talk to them about. And within 2 days, he's doing so much better. So that's the kind of advocacy we do. We also do advocacy. We ask people about their needs. Are they okay in their home? If the whole family is on quarantine or isolation, is someone getting food for you? Are you able to cook? Do you need childcare? Do you need money? Do you need equipment? So we can help with that and make referrals. So that's kind of what we do with our contact tracing. And it's really interesting when we make the contact tracing calls, you get a variety of different reactions from people. And some people say, well, why do you want to know that? What business is it of yours if I've been vaccinated or not vaccinated? And I never want to be accusatory. And we just explain that we're looking to see how many breakthrough cases we've had. We have a lot of people who have been vaccinated, who are usually mildly ill, and then we have the unvaccinated who can be deathly ill, and it's tough. But some people are reluctant to give the information. Some people give some information, but not all of it. We take what we can get, and we go from there. I also check obituaries. I check other things. I check wedding announcements to see if the name comes up, that maybe somebody doesn't want to say they were part of a group, but if you're getting the same name from multiple family members, then you begin to suspect, and we've been able to identify that. So that was pretty much what I had, and then I listed in the paper here a whole bunch of other topics. I do want to recommend to people, by the way, that you get your flu vaccines. We were very lucky last year to have a very light flu season, but it was largely attributable to the fact that we were isolated away from one another. People were wearing masks. We weren't mingling. That's not likely to be the case this year, and we don't know what's going to come of it. So I'd say go back. A lot of people are probably not aware that we have a very significant number of people who die every year from the flu. People tend to think it's mild. I do want to tell you, you cannot get the flu from the flu vaccine. There is no live virus in the flu vaccine. You can get it from the nasal flu vaccine, because that is a live virus. But it can make you feel very flu-like. You could well think you have the flu, because it can make you feel sick, it can make you feel achy, it can give you headaches. The same symptoms, basically, that COVID and the COVID vaccine would give you. But as I say, and when I've done programs, I put pictures up of people in the intensive care units hooked up to the equipment. I put up pictures of the COVID-infected lungs and heart and organs. And what we're finding, which is alarming, is that even in young people who have no symptoms, they're beginning to find these organ damages from COVID. So that's of concern. But with the flu, I would strongly urge people to get their flu vaccine. Now is the perfect time to go and get it. And we didn't really talk about the long-haul COVID. They're finding that teenagers and young people are showing up with long-haul symptoms. Now, long-haul for us is the duration of the illness. We've only had it here for a year and a half. We don't know what the long-term effects of COVID are going to be, but we know that it's showing up in people, including people who have had virtually no symptoms, and that's alarming. So are there any questions? Anything I didn't cover? Sharon, my sister. I can't hear you.
Everybody knows we've had an alarming situation at the border, and a lot of people coming across the border, southern border, have a very high number of been COVID positive, and have been sent to a lot of communities around our country. We don't, a lot of these states are very playing close invest about what towns have COVID positive immigrants, but is our state being upfront about that? What are we doing about tracing these people who might be infected homeless?
For what Sharon said, in case you couldn't hear it, she said she has concerns because a lot of the people crossing the borders are coming into the country with high rates of COVID, which is true. It's my understanding that nobody is being sent from where they come in to any community before they've been tested. So hopefully the veracity of that statement is true, okay, and that's the case. But it is a concern, but it's not only immigrants. We definitely have an immigrant issue because we do have people coming in. We have people coming in now from Afghanistan who are being placed, and I believe we have people here too. Again, this is a pandemic. We have COVID everywhere in the world, and we need to be cautious. And I think the best caution we can do is to, first of all, get vaccinated. Secondly, wear our masks when we're indoors and in settings. Get tested if you have any symptoms. Get tested if you know that you've been exposed. Keep up with the hand washing. I know the CDC dropped its I don't want to say it's guidance, but they're not pushing as much. Cleaning surfaces. I'm a strong believer in cleaning surfaces. You wouldn't want to go into an operating room where your surfaces weren't cleaned. You wouldn't want to go into the doctor's office if they weren't cleaning the equipment you were sitting on. I clean my surfaces, and I clean them frequently, so I would still encourage people to do that. Take the protective measures you can. Avoid being in close contact. Remember, 6 feet, 15 minutes or more, and it can be 10 people, 10 separate people over 24 hours that accumulate to 15 minutes or more. Are there any other questions? Thank you so much for coming. I hope this met your needs. Oh.
You hear a lot about, like, now we have the Delta variant. How do we know that? Because when people I've known that go to get tested, they're not told what variant they have.
Did everybody hear Sue's question? Yeah. We get the results. When we get the results back from the State Health Department, we get the laboratory result. And you find out if the person had a PCR test or a rapid test, and it gives you the breakdown. So we know to a large degree what someone is having. It doesn't always break it down to the Delta, but the state health department has that data.
So
Okay.
there's more on the test, there's more data on the results than we're getting?
Yeah.
Oh, interesting.
Yeah.
Oh.
I believe so. Okay, yeah. Um, oh, yes, Lois.
I've heard that, that the Delta variant tends to have a more prevalent symptom of COVID than like headache.
They have picked up different symptomatology in the different strains, and it's changed. Periodically, even with the same strain, we see differences. I never used to have people telling me they had pain behind their eyes. And now I get a whole lot of people talking about pain behind their eyes. We didn't used to have people talking about having GI symptoms. And now it's been added to the list because a whole bunch of people are reporting nausea, vomiting, diarrhea. So we ask about that too. It makes it very difficult for people to know what they should be worried about because so many of the symptoms of COVID are the same symptoms as the flu, the same symptoms as the common cold, the same symptoms as an allergy, itchy eyes, a scratchy throat. So it's hard to say. I think if you have any symptoms, get yourself tested. Yes. And she had that after the third. Yeah. Yeah. I, yeah, I can't wait to get mine. I keep thinking any symptom I get is going to be better than being in the intensive care. Yeah. But the pain behind the eyes, every time I get a headache, I start thinking, is COVID? Okay. So you wonder. But the symptoms change. And children have different presentations too. They can have rashes. You've probably heard of the multi-inflammatory syndrome in children, MIS-C. It comes in children. It's not always there. A lot of children never get that at all, but it's certainly something to be looked for if a child breaks out with a rash. But that rash can also come after they've had COVID and recovered. So you have to be on the lookout afterwards because, again, we don't know what the long-term effects of COVID are going to be. For the Nursing Association, I was so concerned about our nurses and our other healthcare providers being exposed to COVID because there was no workers' comp. There was no, what's the term I'm looking for? I was concerned that we had people who were being assigned to work in locations they didn't know, with equipment they weren't familiar with populations they didn't normally work with. Like a pediatric dose of medications is very different than an adult dose. If you work on a medical surgical unit, it's a very different nursing experience or any other profession experience than if you're working in the intensive care unit. And we met with the governor on a couple of occasions, different ones of us in the organization, and I really pushed for some sort of no-fault sort of a situation, and he did implement something like that. And of course, we had to mobilize people. We had people who were still in training in doctors, nurses, and other therapeutic groups who were working to help deal with what needs to be dealt with in a crisis like this. It's a very challenging time, and it's not over, and I can't caution you enough that we are just a couple of cases away from going back up into the orange zone or back up into the red zone. And right now, I hate to say this, Sharon, but it's Westport and, I forgot what other town. Westport and Ridgefield that are still red zones. Yeah. Yeah.
Remind you again about, as you know, you're introducing my daughter and my COVID a couple of weeks ago. And the Norwalk Hospital, I mean,
Yeah, I was alarmed when I heard that. Um, yeah, but it's different. But I've talked with people who are in other towns, and not everybody follows the contact tracing as diligently as we do here in Greenwich. We are so fortunate to have such a wonderful Department of Health here in Greenwich. The Director of Health has been in her position, I think it's close to 40 years. You have to be qualified to be a director of health. You have to meet criteria. You're appointed by the state. You don't answer to the selectmen or other people. You have authorities that are granted to you under public health. So I think many people are not aware of that. But we are so fortunate. We have such a wonderful team in our town here. I'm so grateful to be back working part-time with that team, and many of them are still there, so it's been wonderful. But I want to thank you all for coming. I hope I've answered your questions. And I do have my name and my phone number and my email on that paper. If anyone has any questions, please feel free to reach out.
Thank you.